do is I'm going to compare my physician order to my MAR. So I'm going to do all of my rights of medication. I first have Mr. John Smith over here, Mr. John Smith with the same birthday and room number and MR number. And now I'm going to look down my orders. I see furosemide, 20 milligrams PO/BID, and same here, furosemide 20 milligrams PO/BID, potassium 20 MEQs PO daily, potassium 20 MEQs PO daily, DIG 250 mics PO daily, DIG 250 mics PO daily, metoprolol 50 milligrams PO/BID, metoprolol 50 PO/BID, and amlodipine 5 milligrams PO daily, 5 milligrams PO daily, and it is 8:30 in the morning, so I'm going to be giving 9 o'clock medications for this patient. Now that those all compare, I'm going to kind of get rid of my physician orders, and I'm going to now start my next check, or let's call this my second check. Get a pen. All right, so furosemide, to give that safely, and it's due now, is potassium level, a sodium level, a blood pressure, a BUN, and a creatinine level. To give potassium safely, I have to look at the potassium level. To give DIG, I got to look at the digoxin level, and I have to check an apical pulse. To give metoprolol, I have to check a blood pressure and an apical pulse. And I'm not actually giving amlodipine because it's not due till this evening, so I'm not giving that one. Okay, so I have 4 drugs to give so far. Let me make sure they're safe to administer. So as far as Lasix go, my potassium is 4.5, which is safe. Sodium 140 is safe. Anybody have a blood pressure?
120/80.
Just perfect. Okay, 120/80, it's safe. BUN and creatinine are both normal and safe range, so I'm giving furosemide. Potassium was 4.5, giving that one because it's also safe to give. Digoxin level is not here. Does anybody have a digoxin level for me?
1.5.
It's 1.5, and that's safe. And I'm going to look at the trends of my vitals here. I will get an apical pulse at the bedside, but I have a 75 beats per minute pulse right now, so as of now, DIG is safe for me to give. And then lastly, I have metoprolol, again, apical pulse 75, blood pressure 120/80, both safe for that drug. So I'm giving 4 medications. So now I'm still on my second check. Second check's a long one because I have to check whether they're safe, and then I'm pulling them out of the drawer. So I'm looking for Mr. J. Smith. I don't have to put on gloves unless I pull something out of a container. So I'm first looking for furosemide, which is here. Furosemide 20 milligrams. I'm giving 20 milligrams, and it's not expired. It's PO. It's due now. I've got to take this out of its container, so I'm going to wash my hands and put on some gloves. These are really, really big. Okay, so what do I first need to do is label my container. And actually, I'm going to use this cup because I don't have. So I've got, ooh, these are good. Furosemide, 20 milligrams for JS, room 1. And that's it. That's really janky, but let's make it work. All right. I'm going to pull this drug out. It looks like I need 20 milligrams, which is what the tabs come in. So I'm just going to get 1. I got 1 in there. I'm also going to keep this out because we have to scan it in the real world. I no longer need the gloves, so I'm actually going to take them off so it looks like everything else comes in its own package. And I'm going to throw those away in the trash. Okay, so then I have potassium, 20 MEQs, and that's what I need is 1. Digoxin. It comes in 0.25 milligrams, which is equivalent to 250 micrograms. And if I didn't know for sure, I'd do my dosage calculation right there. And then metoprolol, 50 and 50. I'm done with my second check. Okay, I'm going to clean my hands again just because I'm about to enter the patient's room. Someone need to be my patient. Hi, good morning, Mr. Smith. How are you doing today?
Doing good.
Good. I'm gonna wash my hands again just because I touched the door. Unless it goes small. I am going to come and give you your medications today. How are you doing? You ready to sit up a little bit?
Yes, of course.
Thank you. I don't want you to lie flat whenever I get you to swallow here in a moment. But for your safety, before I begin, I need to please see your wristband. And if you don't mind telling me, what is your name and birth date?
John Smith, 11/11/22.
John Smith. I'm looking at my my MAR as well, and they're comparable. Do you have any allergies that you know of?
No allergies.
Okay, let me sit you up a little better. Okay, so now, just so that you know, I'm gonna do a third check so that we can together know what you're getting today. So the first drug you're getting is called furosemide. There's 20 milligrams in here, I can see that here. It is to be given twice a day, so that's this morning. That is your diuretic, so it's gonna actually make you urinate more to get some excess fluid off of your body. The next one I have is potassium chloride, 20 MEQs. It's to give orally, and that's due right now. That is to replace any potassium loss when we increase your urination. Next, I'm going to give you digoxin. That is the correct dose, 0.25 PO, and it's due also right now daily. That is to help your heart beat a little more efficiently. And then lastly is your blood pressure pill. It is metoprolol, 50 milligrams, and it's due right now daily PO. So those are the 4 drugs I'm going to give you. Do you take all your pills at once or one at a time?
I take them all at once.
Okay, so before I do that, I'm going to get my stethoscope out. I want to be sure I listen to your apical pulse, and I listen for a full minute, and I get
79.
79. Okay, so dig is still safe. I'm going to keep it out, and you're going to get all 4 of these like we said. Okay, so I'm going to go ahead and open that, add it to your Lasix, open that, add it, since you said you take them all together. Can I get you to first take a sip of water? Sip, sip, swallow, no coughing and choking. All right, now swallow these down, and then chase it down with some water. All right, did they all go down?
Yes, they did.
All right, well, that's all I have for you today. Let me get your call light, make sure you're positioned comfortably. I'll be back in probably about an hour to reassess your vital signs to make sure everything's going in the right direction. Do you need anything else from me right now?
No, I'm good, thank you.
All right, I'm gonna throw those away and clean my hands again. And now I'm gonna come outside the room, and I'm gonna document that we line through it with my initials, gave furosemide, line through it and my initials for potassium, line through it and my initials for dig, and I'm also gonna put AP79 at the bedside, and metoprolol line through it, DL by it, and then I have to put my full signature at the bottom, my initials so they know who I am. All right, and that's it. Done.